I will be transitioning out of the Army. And I'm extremely excited about the signing of this bill today. This bill will allow veterans like me who have multiple medical issues to receive timely and world-class medical treatment.
Approximately 9 million veterans use the VA health system today. In June of 2014, Senator John McCain introduced the VA Choice Act to help provide care to more veterans. The Choice Act was signed by President Obama on August 7th of 2014. The first set of choice cards was sent out on November 5th. As a veteran, you may be eligible if you need to wait more than 30 days for an appointment. You're more than 40 miles from the closest VA. You travel by air, boat, or ferry to the closest VA. You face unusual or excessive burden. You live in a state or territory without a full-service VA medical facility.
As of right now, the VA health services needs to be a little bit more robust because there's so many more people coming into the system.
If tomorrow
I'd say the biggest problem is the rotation of medical care providers.
I think the biggest problem that the VA healthcare system faces right now is, and I've never experienced it, but you hear a lot of individuals talk about the fact that it takes a while to get in to see an appointment.
Because the flag still stands for freedom, and they can't take that away.
I believe for here, there's two parts of that I would answer. The first part of that is when you look at the VA Black Hills, it's almost like a small local doctor's office. The second part of it is, and I'm not service connected, so it doesn't really affect me so much, is that a lot of the individuals who are working at the VA, no matter whether they're in the medical side or the mental health side, are trained and work and receive specific training to deal with war injuries.
From the lakes of Minnesota.
I think the biggest thing is that they need to provide medical professionals compensation enough that they want to work there long term. Because if you have that, it's a little bit more steadier in terms of you can have a healthcare provider for a long, long time, which is not something you can do right now.
And it's time we stand and say that I'm proud to be an American.
You know, the VA, one of the things that the VA could look at, again, and they've started a little bit with the choice program, is every year, for example, for myself, every year I go and have a annual physical done. I go in and I have the blood work done, and when the blood work's done, then I go see the doctor and they do all of those things. Part of what the VA could do is they could actually allow me to go to a private doctor, and that the VA do kind of like a medical insurance type thing where they submit the bill to the VA and then the VA pays, similar to what an insurance company does. What that would do then is relieve a lot of the routine type of medical things that take place within the VA. If there was an issue then I could be referred back to the VA and then deal with those issues that cost more money and more time and higher level of treatment. I think that's going to be one of the big things to watch in the future with the VA is how they handle that, how they handle taking care of the individuals that are coming to them for care who have served our country honorably and have been able to get in there. So
There are many problems with the VA Choice Act. These problems include long wait times to receive care, the need for more doctors to fill open positions, and a need for the increase of the quality of care. We believe that the presidential candidates should work towards fixing the VA health system and the choice program because these men and women served our nation and deserve good quality care.